program. So there's a training that goes on in some graduates that they're activists for creating a good health within the health systems for the work we're doing in chronic disease prevention. And then the provider toolkit again. And if you want more of these, please let me know. My email is at the end of this presentation. I can send you some. And this is what we can do together. So this is the working together part. So if our goals to collectively are to increase awareness about diabetes, especially at high risk folks for type 2 diabetes, and we're promoting participation in the management classes and the lifestyle plans. We really want to use the team-based approach, whatever that might be called for you, that we work together and that we are able to make it as streamlined and efficient as possible, easy on the provider. And then what we were talking about before is to increase the programs in the community settings. And again, these are ones I've already mentioned, but just to wrap up our goals, we're engaging the community because we need the support, and we need spokespeople from the community. We need people that actually are affected by this in their lives. And you don't have to raise hands, but I'm sure most of you have someone you know, either friend or family, that is either pre-diabetic or has diabetes, especially with these numbers. It's a very good chance. We want to increase the number of programs. We want to make sure that those people are identified and helped. So for both hypertension and prediabetes, they're closely related. So this is the part where when I came here, when I was invited the last time for LA, I really wanted to put kind of a call to action out to you, is what you can do, what could be your role. And this is more like a list of possibilities. But the first one is to promote the campaign. You really enjoyed it. It's easier sale. You can even show your management or whoever you need to influence. If nothing else, people love these ads. Direct people to the Do I Have Prediabetes website, and which includes the listing of the national DPP programs. Recommend and advocate that all health plans include national diabetes prevention as a covered benefit. So this is now a possibility. We hear more about that with some of the health coverage folks saying that they will cover it, and there's more to come that we hear for California. That some of the major ones are going to announce. That was just a tickler, because I can't tell you. We're going to advocate, adopt, or implement clinic protocols. So how those would work within your system to refer patients. And then some of you are already doing this. But to use electronic health records as a mechanism to identify and target patients that are at risk, and adopt evidence-based treatment protocols, provide decision support for the healthcare team and reminders for patients, and implement clinic protocols policy to refer persons to the National Diabetes Prevention Program. I rounded it up. Did it go too quick to get? Yeah, questions? Yes.
I have two questions.
Yes.
To what extent are you reaching out to the academic community, the high schools, the elementary schools, dealing with kids in general? And secondly, to what extent are you reaching out to corporations that have healthcare programs that are sensitive to the overall health of their workforce, where premiums go up and down depending upon how one participates in wellness programs in the office or in the factory?
So for the first one on children, we do have funding that goes towards promoting good health in schools for children. We work with the Department of Education. The messaging may or may not be directly related to prediabetes, but it's for good health and lifestyle, the importance of physical activity and nutrition. For the other one, we have invited businesses. I don't have the list in front of me, but we're we really want businesses, because they're the biggest employers in California, to be part of the conversation. So that hopefully more of that will come out as we work to kind of, again, roll up our sleeves and get farther along with our state plan.
So I like the idea about the schools, but I would take a little bit different tactic to tell the kids to get their parents screened for prediabetes. Because often, doing it yourself, you don't do it for yourself, but you do it for your kids and your family. And so having the children throw the cloak of shame on their parents is often effective. because they care about them. And it would seem that that would be a good tactic, perhaps, to get more people screened and go and use the online tool.
So is the screening the questionnaire, or is the screening the testing for A1C?
Screening is a questionnaire.
The questionnaire, and testing is the A1C.
Again, if they have prediabetes, their hemoglobin A1C probably isn't going to be high. They might have impaired glucose tolerance, though. So again, you're probably not going to find an elevated hemoglobin A1C, because if they do that, probably by definition means they're diabetic.
Well, that could be crazy.
Anyone else have any questions?
Do you know how many CDC recognized prediabetes programs there are in Sacramento?
Could you say that again, Dr. Buss from the Sutter Medical Group?
Do you know how many CDC recognized prediabetes programs, DPP programs there are in Sacramento?
I don't, I know we created a map that's at the office that someone else created, but Camille, do you know by any chance?
Is that map available online?
It will be soon. Through our department, we always go through approval process, so it's still not quite ready, but we want that out because we want to be able to answer that question when someone asks, where are the ones in our area?
Because I think there's a real shortage of CDC recognized DPP programs,
Yes.
but there might be some Sacramento on that road.
Yeah. No, I think that's part of our challenge here in California, sure, just throughout the state.
Mary?
Mary?
You know, there are diabetes self-management education program or classes being conducted, even by the medical groups and their plans, and HSAG, as the Medicare Quality Improvement Organization, is also organizing a lot of these classes across the state. The question is, and we, in our classes, we include pre-diabetics. So the question is, you know, what's the distinction between a DPP class and a DSME? And why can't we just, send a message out to physicians that if you have a DSME class nearby, refer your pre-diabetics to it? What's the difference?
I would look to you on the difference
I
of
know.
provider, yeah.
I know the difference.
Dr. Buss, yes?
Sorry, I just have to know the difference. The difference is that the DPP program is an intensive year-long program that has a very different focus. It's a year-long program that has kind of a core component that's very different, and it's weekly for at least 16 weeks, and then every 2 weeks or 4 weeks for the rest of the year. That has to follow a very specific curriculum. It's not the same thing as DSME. So you can talk about prediabetes in DSME, and you can address some of the issues with people with prediabetes and DSME, but the diabetes prevention program itself is very structured, and it has to follow a very specific curriculum, and it's year-long. So, and it has to have all sorts of different outcomes being measured that make it recognized by the CDC. So,
Maybe we can hear, like, what are you doing at your system about that?
well, that's the short answer. Sutter Health has got many different affiliates, and each affiliate is kind of doing different things related to prediabetes. Within the Sacramento region, there is a program that is based on the CDC prediabetes program curriculum. And that is a program that's offered in a wide variety of the Sutter different care centers around here. Something like a dozen of different care centers, or maybe it's not a dozen, but like 8 or 10 different sites. But even that is not a CDC recognized program, it's just based on the same curriculum. So then there is kind of, I think, an attempt on our part to increase our understanding of how to create CDC recognized programs. And I think probably all healthcare systems are having the same conversation with themselves about how to do this in an effective way. Because it's very intensive. A CDC recognized program for diabetes prevention is far more intensive than DSME. It requires more hours. So,
Thank you.
Why is it important to have a CDC recognized program?
so Susan here, I know, has a question for me.
I'm your board.
Why is it important to have a CDC recognized program? Because the CDC recognized programs have used all the components of the DPP that we know make it likely to have the outcomes that we expect from DPP. So DPP has shown substantial reduction in the risk of diabetes, but you could only kind of know you'll have that benefit if you follow all of the same requirements of the DPP program. So that's part of the reason that it's so important that you get CDC recognition, and also because that's how you get reimbursement ultimately from the insurance companies. So that's going to be the other key component.
Okay, great, thanks so much.
Thank you.
So Dr. Lee, come on over, we'll have you sit. I get to introduce you. Thank you for braving the traffic all the way. Now I have to apologize because I didn't have a chance to speak with you first, so everything I'm going to tell you about I got off of Gawker and the week before.